research shows that people with gum disease face 2 to 3 times the risk of heart attacks, strokes, and other serious cardiovascular events. It's tempting to dismiss this connection. After all, those who neglect their oral health might also have poor diets or unhealthy lifestyles. However, recent studies suggest a more direct relationship that gum disease itself may independently increase heart attack risk. So in today's video, we'll examine studies that show how improving your gum health may boost heart health. You'll also learn practical steps to enhance your oral hygiene, including surprising foods and drinks that make a real difference. Alright, let's dive straight into the nitty-gritty. Gum disease starts subtly. You might notice your gums looking a bit red, feeling tender, or bleeding when you brush. This is called gingivitis, the early warning sign for gum disease. It often starts with plaque buildup and food particles between your teeth. This creates a breeding ground for bacteria. If not removed regularly through brushing and flossing, this mixture hardens into tartar, further aggravating the problem. But of course, as we'll get to shortly, brushing and flossing aren't the only factors at play here. If left unchecked, gingivitis can progress to a disease called periodontitis. This more serious condition affects not just your gums, but the structures supporting your teeth. Signs of periodontal disease include persistent bad breath, gums receding from teeth, pus between teeth and gums, and eventually changes in how your teeth fit together. So, how does this impact your heart? Researchers believe it works through 2 primary mechanisms. Firstly, chronic inflammation. When you have gum disease, it's like having a small fire in your mouth that never goes out. Your body's always on high alert, trying to fight off the infection. This constant state of inflammation doesn't just stay in your mouth. It spreads throughout your entire body. Think of inflammation as your body's fire alarm. When it works properly, it alerts you to danger and helps you respond. But imagine if that fire alarm was constantly blaring at full volume. You'd be stressed, irritable, and unable to function properly. That's what chronic inflammation does to your body. In your heart and arteries, this non-stop inflammation can weaken blood vessel walls, make it easier for plaque to build up, and increase the risk of artery damage. It's like the fire alarm's constant blaring is actually cracking the walls. In a moment, we'll look at a study showing that certain gum health habits can significantly improve C-reactive protein levels, the main marker for inflammation and heart attack risk. But before that, the second mechanism is bacterial invasion of the bloodstream, medically known as intermittent bacteremia. Gum disease damages your gums, creating tiny openings in the tissue. These openings are invisible to the naked eye, but they're large enough for bacteria to pass through. That's why eating plenty of foods that support collagen synthesis is important, because collagen is the foundation of strong gum tissue. We'll get to the best foods shortly, but for now, once in your bloodstream, these bacteria cause big trouble. They release endotoxins, which trigger more inflammation and can directly attack your blood vessels. It's like letting vandals loose in your circulatory system, and can lead to serious endothelial dysfunction. The endothelium is a thin layer of cells lining your arteries. Normally, it keeps your arteries smooth and flexible, so blood can efficiently flow to your heart. But the bacteria damage these cells, making your arteries sticky and inflexible, leading to high blood pressure and accelerating cardiovascular disease. Likewise, research shows that it can also damage LDL cholesterol. You've probably heard of LDL cholesterol. It's often branded as the bad cholesterol, but that's a gross oversimplification. Think of LDL as a delivery system, transporting fats and raw molecules throughout your body to where they're needed. These molecules are then used to produce hormones, keeping your nerves healthy, synthesize vitamin D, and maintain strong bones. LDL is your body's delivery driver, ensuring all the lipids, fats, and other molecules get to where they're needed. But when LDL becomes damaged or oxidized, things go very wrong very quickly. The inflammation from gum disease triggers a process called oxidative stress. This essentially rusts your LDL cholesterol. Once oxidized, these particles become sticky, latching onto your artery walls, like barnacles on a ship's hull. Your immune system recognizes a threat and sends white blood cells to attack it, further increasing inflammation and plaque buildup, restricting blood flow to your heart. It's a recipe for disaster. Fortunately, research shows that a few strategic changes can make a big difference. For example, a 2005 clinical trial found that periodontal treatment substantially improved oxidized LDL levels. Significantly, men who had gum disease and coronary heart disease were split into two groups. Half received a course of dental cleanings and gum treatments over several weeks. 3 months after treatment, the periodontal therapy group saw a notable decrease in oxidized LDL cholesterol, while the untreated group saw no changes. C-reactive protein, the key marker of inflammation and heart attack risk, also declined significantly in the treatment group. Another trial, this time by the University of Connecticut, found even greater evidence for the cause and effect relationship. This time, one group got basic oral hygiene care, while the other group received intensive treatment, including deep cleaning under the gums and removal of teeth that couldn't be saved. This is similar to what you might expect from regular dental care, plus daily hygiene over a lifetime. Researchers used ultrasound to measure how well arteries were functioning, and after 6 months, the group that received intensive treatment was significantly healthier than the basic group. Not only did they have more flexible and clearer arteries, blood tests also showed better levels of C-reactive protein, interleukin-6, and soluble E-selectin, signaling lower levels of inflammation throughout the body. Okay, next let's dive into some insider tips to keep your mouth and gums healthy, potentially reducing your risk of heart disease. First and foremost, the foundation of good oral health is regular brushing and flossing. Brush your teeth at least twice a day and floss daily. This removes plaque and food particles, preventing the buildup that leads to gum disease. If your dentist says you have gingivitis despite regular brushing and flossing, ask for a demonstration to make sure you're doing it correctly. Small tweaks in your technique can make a big difference. Regular dental checkups are crucial. Even with perfect home care, professional cleanings and checkups help catch gum problems early and keep your mouth in top shape. Aim for a visit every 6 months, or more frequently if your dentist recommends it. Next, consider adding a mouthwash to your routine. This can further reduce bacteria and plaque, enhancing your gum health. Swish it around your mouth for 30 seconds after brushing. Next, stay hydrated. Drinking plenty of water throughout the day helps wash away food particles and bacteria, maintaining a clean mouth environment. It also stimulates saliva production, which is your body's natural defense against tooth decay and gum disease. Another important step is to avoid tobacco products. Smoking and chewing tobacco can cause gum disease and delay healing. If you currently use tobacco, quitting is one of the best things you can do for your oral and overall health. Your diet also plays a key role. Limit sugary foods and drinks, as sugar promotes the growth of bacteria that cause gum disease. When you do indulge, try to brush afterwards or at least rinse your mouth with water. Likewise, chewing sugar-free gum after eating stimulates saliva flow and also helps to wash away food particles and bacteria. For an extra boost, try chewing gums infused with clove oil or clove essence. Cloves contain eugenol, a compound with powerful antibacterial, anti-inflammatory, and analgesic properties. This can significantly reduce harmful bacteria, relieve minor pain, and soothe irradiated gums. Some people even like to chew on whole cloves, and they swear by it to keep their breath fresh and gums healthy. Another ancient practice that's gaining attention is coconut oil pulling. That's where you swish a tablespoon of high-quality coconut oil in your mouth for 10 to 20 minutes, once a month or so. The lauric acid in coconut oil has potent antimicrobial properties that can reduce harmful bacteria, improve gum health, and potentially even whiter teeth over time. Are you finding this useful? If so, please click the like button, and if you haven't already, click subscribe to be notified when we release new videos. Now, there are also a few good foods that directly support the health of your gums. For example, onions contain powerful compounds called allicin and quercetin. These are antibacterial and antimicrobial. They can eliminate harmful bacteria in your mouth, so make sure to include some chopped raw onion in your salads. Vitamin C is also crucial for gum health due to its role in collagen synthesis. Collagen keeps our gums strong, firm, and resilient, helping them to seal tightly around your teeth and resist bacterial infiltration. So be sure to eat plenty of vitamin C rich foods, especially citrus fruits, berries, kiwi, bell peppers, tomatoes, and cruciferous vegetables, which all have added benefits. Similarly, vitamin D plays a significant role in tooth and bone health. Sunlight is your best source, but you can also get small amounts of vitamin D from fatty fish like salmon, mackerel, and sardines, as well as eggs and mushrooms. Next, a few strategic drink choices can also make a big difference. Unsweetened cranberry juice has been shown to prevent bacteria from sticking to teeth and gums, which is a similar mechanism for how it prevents urinary tract infections. In fact, a study titled Cranberry Polyphenols: Potential Benefits for Dental Care and Periodontal Disease, published by the Canadian Dental Association, found that cranberry may be an especially good ally. In the trial, people used a mouthwash that contained cranberry extract every day. After 6 weeks, they had significantly reduced Streptococcus mutans bacteria in the mouth. Researchers concluded that cranberries have a potential for preventing and treating periodontal disease. Likewise, green tea and herbal teas contain powerful antioxidants that reduce inflammation and inhibit bacterial growth throughout the body. And don't forget milk. It's rich in calcium and phosphorus for strong teeth and enamel. Do you have your own habits for oral health? Leave a comment and let us know. Next, you might like to watch our video on the top 10 vegetables to unclog arteries. We'll leave a link to that in the description, or click the image on screen.